I was told that I had holes in my teeth, and then she started telling me that toothpicks are not too good. Is it good? Change all this bad attitude. Fine girl, fine boy. Ain't me báwo ni o ṣe wà? Share. Hi guys, welcome back to my channel. I know, right? Long time no see, right? Yes, I am very much back. Like I am back, like I never left. I am back with all the juicy topics, gist and vlogs. If you're new here, my name is Adenike Faliti. I film about lifestyle, faith, vlogs and health. So if you're new, please do well to make yourself comfortable in this community. You're most welcome. And to my old subscriber, thank you so much for always coming back for your girl. In today's video, I'll be talking about a topic that is very dear to me. You know, sometimes when you make a mistake or when something happened to you, you are saying the story for others to learn, to relearn and unlearn. If it's something they're doing, they should stop, retrace their step through that learning process. So that is why I am doing today's video. Today's video will be about the danger of toothpick. Someone will be like, you want to know toothpick by Ebola to just see, like, where are we going to? Exactly. Today I'll be talking about the dangers of toothpick. You know, when you learn the hard way, you really want others to learn from a mistake and do things in a more better way. I'll be talking about my experience before I go into details. Why is it dangerous? Why is it not? Why is it of more harm than good? And why you should not use it. So first off, I remember my very first time I had a dentist appointment where I got to see the doctor, where I got my mouth examined. I was told that I had holes in my teeth, and I remember when they told me I had holes in my teeth, in my head I was like, oh, I was imagining big holes, but meanwhile they were kind of like tiny holes in my teeth, which if they are not being taken care of would get more bigger and could cause 1 or 2 damage to one's oral health. So I decided to fill those holes up. They did a composite filling for that teeth then, and I think it took me a while before I had the opportunity to get my teeth or my mouth checked again, because I changed my job and I changed my workplace. So before I settled down, got used to the whole environment and the system, it took a while. So by the time I checked my teeth again, it was like about a year or more that I had the opportunity to check my teeth again. So after that opportunity to check my teeth again, when the dentist got a look up, then they were telling me that there was hole again. I'm like, are you guys whining me? Oh, bitibawu. Like, I just feel this teeth. Is it that long? Is that how hole used to happen? What's in the hole? Then the dentist began to interrogate me. Do I use toothpick on my teeth? I say yes, I use toothpick on my teeth. Then she started telling me that toothpicks are not too good for the teeth, and I was wondering how. I was going through my gallery and somehow I documented the day I went for my scaling and polishing, which was also the day I saw the dentist. So I said, why don't I do a video to enlighten people about this thing? For some, they are already enlightened, they know very much about everything I'm about to say, and why some, they do not have any idea of what I am about to say. That's why I decided to share this for someone to learn 1 or 2 from it. So why am I telling you not to use toothpick on your teeth when you have meat stuck in your teeth, in between your teeth? Why am I telling you not to use toothpick? Why do you think you really want to listen to me when I'm telling you not to use toothpick? One of the reasons is toothpick can cause holes, cracks in your teeth. As a result of you trying to remove the meat, especially when the meat or whatever particle that is in your teeth that is stuck is not coming out. And you know, toothpick has this pointed edge. There's this like force you're trying to exert on your teeth. So in a continuous manner, it's going to cause hole in your teeth. Growing up, I've always known toothpick as something that they use to remove stuck things in the teeth, meat or anything that gets stuck in your mouth or your teeth. But getting to know that, like, okay, it's not okay for me and all of this. So you can imagine all my life I've been using toothpaste. So if they are creating holes in your teeth, When we're moving to another level, then they can damage the gums in the process of trying to get rid of the meat or whatever is stuck in your teeth. You'll be using that pointed edge of your toothpick to eat a part of your gum, which could cause damage to your gum. So why am I telling you not to use toothpick? My third point is that it's like a way of pushing bacteria or food particles further into your teeth. If there is a hole in your teeth already, and in the process of you trying to use toothpick to remove something from your teeth, there's a way you're trying to push food particles into your teeth back. And if that part of your teeth is already what's it called, degenerating, that could cause more harm than good. And why am I telling you not to? Pain. It causes pain and sensitivity. At that point, it could cause a temporary pain or a chronic pain. If for someone that has tooth issues before that incident of trying to use toothpick on your teeth, it could cause pain. Why am I telling you not to use toothpick? Because it could cause infection and abscess. Where in the case of where the gum gets damaged, it could cause the swollenness. And why am I telling you not to use toothpick again? It could even damage a dental repair they might have done. Imagine me that I had filling. They filled the hole. That means they closed the hole. And a year after, they're telling me that there is still hole in my teeth because I continue using the toothpick and it continued doing the damage. The main reason why I was having those holes, I did not take care of it, which was the toothpick. I was still using it due to my ignorance. So that is why I am doing this video, to make one person or two persons informed about what that toothpick you're using on your teeth can do to you. So now I am telling you not to use toothpick. Madam, you don't talk since morning. Me will not use toothpick. Okay, what should I use? Yes, what should you use? You can use interdental brush, very tiny kind of brush, but it can go through your teeth when you want to get things that are stuck out of it. You can use flux as well. Flux, you can get it in the supermarket, pharmacy. You can use flux. And for water picks, I don't think it's something that is in constant use in this part of the world that I reside in Nigeria here. But I think if it's for European countries, probably they might be using, but water picks is also an option. Now let's talk about, so that we can all be on the same page, let's talk about like the best oral practices you can ever do for yourself. When you do all of these things, you be sure that you are giving your mouth the best care that it needs. Yes. So first thing on the list is brush twice a day. At least brush twice a day. Torí Ọlọ́run. Very important to brush at least twice a day. And you are brushing your teeth with fluorinated toothpaste. I remember there was a time I was using just herbal toothpaste. In my head, I was like, okay, how about do they work now? But the question is, does it have fluorine in it? Fluorinated toothpaste, fluorinated mouthwash. Brush your tongue. Let's go through the process of brushing our teeth together. When you want to brush your teeth, what part of your teeth did you brush first? What did you say? Exactly. You are not brushing that teeth well. That is where the problem is. You're not brushing that teeth well. Don't worry, Adenike is here for you. Now, if you want to brush your teeth, the very first part you should start with is the outer part of your teeth. The outer part of your teeth, brushing like in a small circular motion, trying to take your time. Most of you want to be like that man in this video I'm going to show you. Just want to brush picture. Even when you are at home, when you are free during the weekend, you still want to brush picture. Just brush fast. Take time. Just give yourself time. Anytime you have that free time, anytime you're not in a haste to go anywhere, take time, take care of your mouth, brush it. You're not rushing. Brush that. Take time. Small circular way. From one teeth to another, from the outer part then to the inner part of your teeth. Then thereafter, you move to the chewing, like the biting surfaces of each teeth, up, down. And please, your tongue. Brush your tongue. Torí Ọlọ́run. That G deserve a good treat too. Brush that tongue. Yes, please brush your tongue. Now I'll be moving to the next point. Limit sugar and acidic food. Limit sugar and acidic. This one is not a news again now. That normal, you're supposed to reduce sugar. If not for your teeth, for general well-being, reduce sugary things, acidic food, any food that will be peppery, carbonated drinks and all. You know this one already, right? The next point is avoid smoking and tobacco. I think one day I'll be doing like a proper topic. I'll be talking about it in depth. Like sometimes I feel like ignorance, all the less some people understand, say some things they occur due to some things where you just open your mouth, throw inside am, they chop, or the things where you do. Yes, because smoking and tobacco keeps an individual at risk of having oral cancer, gum disease, and even tooth decay. Because once an individual is taking alcohol and there's sort of plague in the teeth, and it's constant, happens constantly, it can result to tooth decay. Please and please, I beg, normal safe, apart from oral health, general well-being is not good. Thank you. Clean your teeth after meals. If you are lazy, you don't want to brush at every time, I just feel like if you cannot even stand up and brush the teeth, at least make sure it's clean. Drink enough water. Use water to rinse your mouth. If you don't want to brush, you can just use the water to rinse your mouth and be a bit clean than for you to just eat, keep eating everything and just slept that way and all of that stuff. And you wake up, you'll be expecting a fresh breath. Fully fresh. Normal, fully fresh. I'll be moving to the next point, which is use a straw. If you are taking something that you feel like is acidic, to prevent the risks of that acidic content touching your teeth, you can just use a straw, take the content to reduce the contact of that acidic content on your teeth. The next point will be replace your toothbrush. Some of you, since this year started, is that brush that you have been using since the year started is what you are still using? Ask yourself, is it good? Is it good? Change all this bad attitude. Fine girl, fine boy. Have you changed your toothbrush this year? When was the last time you changed that your toothbrush that you're using? You should change your toothbrush at least like every 3 to 4 months, or when the bristle, like that brush part of it, is already looking weak. You might not even have to wait to that 3 months, but you notice that the toothbrush is not looking so good. Please change it. Tell your neighbor, madam, when was the last time you changed your toothbrush? My next point will be avoid biting and chewing hard objects. All of you, I didn't even understand. Obviously, you be eating ice block with your teeth. Some of you have even turned your teeth to opener, bottle opener. You want to quickly drink Coke, you also come. Sister, just ask yourself, is that attitude, is it demure? Is it mindful? Maybe you should change your ways. Please and please avoid biting or chewing hard objects. It's not so good for your teeth because somehow you're causing this, you're giving it this stress, making it hypersensitive, and even exposing it to pain. And last point will be visit your dentist. Ask yourself, when was the last time you saw a dentist? When was the last time you even pamper your teeth? Some of you just pamper your skin, spa everything and all of that stuff. Don't neglect some things. A damage to one is a damage to all. If you neglect one part of your body, that one part you neglect can cause damage to all parts of your body. So when was the last time you visited the dentist? When was the last time you checked your teeth? So it is advisable you visit the dentist every 6 months. Don't wait till you have one pain. Don't wait till you start feeling one sensitivity in your teeth. Don't wait for that before you see your dentist. See your dentist every 6 months. Get it clean, get it checked, get it properly examined. It is best for you. I do hope with everything I have said, you'll be able to scrap and dump toothpick in the bin, and also practice all the steps, all the points I have listed for your better oral health. And if you've experienced anything like this, or if you have tips also that can help us with our oral health, please drop it down at the comment section. Thank you so much for staying till the very end of this video. Please do well to subscribe, like, share, comment. I'll be more than glad to have you in this space. I'll see you in my next video, and bye.